If a doctor refers a patient to get a MRI brain because of memory loss, is it a good idea to also include T2 thin coronal hypothalamus slices, or is it a regular T2? No, you are supposed to do. If it says memory loss, you surely should get a coronal T2 for hippocampus, not hypothalamus. I suppose you meant a hippocampus. Those temporal, mesial temporal lobe coronal, those you scan just like this. Just grab a, this is a CT scan, but I could just it's just anatomy, right? So you do go like this, and you do a scan just like this. You go from here to right about there, like this. So those coronal hippocampus sequences, T2. It could be a T2, it could be a FLAIR, or it could be also a IR, a inversion recovery T2 that makes cortical and white matter much well defined from each other. So you could do one or two or three of those sequences, but if you only have to do one, I'd say you do a coronal T2, and it's fine. It's okay. It's useful. Usually we have some kind of we are looking for the referring physician is looking for some sort of dementia related illness. So it's nice to have a coronal hippocampus sequence to rule out or ruling Alzheimer's disease. It's also nice to have that, and a FLAIR for epilepsy. If it says epilepsy, seizures of some sort of epileptic disease or suspected epilepsy, something like that, it's nice to do both a T2 and a FLAIR. So this is another spine MRI of that place that has a very old and mal maintained scanner. It says here this patient is 69 years of age, and there is no history, no clinical history. It just says she has lower back pain, and it's mostly on the left. So as you guys can see, this is chronic. There is some sort of right there, maybe some edema right there, some modic 1 and 2 could be. There is mild protrusions. See, maybe an extrusion here. The field of view is too big, so resolution is quite low. We could say from L3, 4, and 5 to S1, protrusions 3, protrusions right there. The neural foraminal seem fine. Maybe there is a mild stenosis here. Maybe mild stenosis here, so we could say that on L5, S1. Let's just see the axial. There is a kidney cyst right there, which I'm not going to report because this isn't a abdominal scan. This is a lumbar spine scan. So chronic denervation all over the muscles. This is severe arthrosis, stenosis of the vertebral canal. There is clearly thickening of the yellow ligaments. And indeed, we can say there is stenosis of the neural foramina on L5S1. So this could be a justification, a cause, a reason for this patient's complaints. Let's grab a template. I have a template for this right there. So the three last segments, the three inferior segments have protrusions. There is mild stenosis of the vertebral, the neural foramina of L5S1.